everyone. Thank you for joining us on this live stream. My name is Lynn, and in a bit I will be speaking to a doctor who has been on the front line in Wuhan fighting the COVID-19 pandemic. So just to give you a little bit background of this doctor, he is the Deputy Director of the Pulmonary and Critical Care Medicine Department at West China Hospital in Sichuan Province. That is one of the most prestigious hospitals in China. He in fact led the first batch of medical personnel from West China Hospital to Wuhan to reinforce resources at the epicenter. So without further ado, let me bring in my guest for this evening, Professor Luo Fengming, who joins me via a video call because you're actually under quarantine right now in a hotel in Deyang. Professor Luo, thank you so much for joining us.
Hello, everyone. Yeah.
And thank you so much for everything that you have done for us. Welcome back to Sichuan Province, your hometown.
Thank you.
Professor Luo, you spent 2 months in Wuhan, 2 months at the epicenter of the outbreak, and you just got back to Sichuan last weekend. It must have been an incredible experience fighting on the front line. What was it like being on the front line, day in, day out, fighting this battle?
In fact, I worked in a hospital with totally different from a West China hospital. So it's a challenge for me. I arrived in Wuhan on the first day of the Chinese New Year and worked every day over there because I want to help more people, more patients, so I have to work so hard. I have to work 6 to maybe 12 hours in the hospital, depends on the situation. And when I return to the hotel, sometimes I feel very hungry. And there's still a lot of things to do for me to do because I'm the leader of the team of yes.
So you were working, yeah, I can imagine. So 6 to 12 hours every day.
Most time maybe just 4 to 6 hours, but sometimes you should work longer.
And you were in a protective suit all this while, right? Throughout the whole time that you were at the hospital?
No, if I worked for 12 hours, maybe I just change the protective suit, yeah.
Right. So, Professor Luo, I mean, you were in charge of 2 general wards and an ICU unit in Wuhan.
Yeah.
Right? And you actually, I think you told me before this that you helped recover 284 patients. These patients recovered, they were discharged, but 20 patients actually died in your hands,
yeah.
right?
Yeah.
Talk to us about your treatment plans, your strategy. How did you go about treating these patients? Let's first start with those with mild symptoms.
Yeah, there's maybe as to the middle patient, we just give some antivirus drugs and sometimes give them some medicine for relieve the symptoms. For critical patient, we may give some support, for example, fluid and oxygen therapy, and sometimes high flow, and sometimes non-invasive ventilation, and sometimes maybe intubation and this kind of treatment for the patient. And some patients recovered from the treatment, but some died and feel so sad for them. Yeah.
Professor, about 80% of COVID-19 patients, they experience mild symptoms, right? Did you, I mean, observe the same thing? Your patients, 80% of them, I mean, they experience mild symptoms, right? And you mentioned antiviral medicine.
Yeah.
What kind of medicines are these, and how effective were actually these antiviral medicines?
I don't think the medicine for antivirus is effective enough to control the disease. Sometimes you use a lot of antivirus medicine, and the patient still progressed and even died. And so I think scientists should try their best to made some medicine for this disease, I think, yeah.
But right now, there's no vaccine yet for COVID-19. So for the patients who recovered, who you've helped to recover actually, what were some of the successful cases? How did you help them specifically recover?
We administered the patient with antivirus medicine, though I don't think it's very effective. Sometimes we give the patient support. For example, I just mentioned oxygen therapy, and also if there's a bacterial infection, we also give the antibiotic for the patient, and this also nutrition supportment and other things, just like what we did in regular clinical practice.
So these antiviral medicine, they were not entirely effective, but they actually did help to bring down the symptoms. Would you say that?
No, I don't think so. Yeah, because there's still, you have to use some antivirus for this disease. We don't know what kind of medicine is very effective for the patient, but still we want to try our best to help the patient. Yeah.
So these patients actually relied on their own immune system at the end of the day to fight this disease.
I think most of them recover by themselves, and sometimes we give them support and to help them to overcome the very, very difficult time for them, and that's what the doctors did. Yeah.
Professor Luo, now we are actually seeing cases in Europe, in America, around the world. They're increasing rapidly. And I understand that you were actually in talks with some medical experts in Europe just before we actually went online. How bad is the situation in Europe? What were the medical experts mostly concerned about?
I think the situation in Europe, just like in Italy, is just like the early stage of the Wuhan. So my director, Professor Liang, still in Italy, he called me last night and discussed the situation of Europe, and it's almost the same in Wuhan. But he told me that there's just a little bit of very few people on the street, and there's very few cars in the street. So I think maybe the new cases of this disease maybe will be decreased maybe within 1 or 2 weeks. Yeah.
Are they facing the exactly same challenges as Hubei province when the outbreak first, got big?
I think so. Yeah.
So, Professor Luo, what tips?
In China, we have a lot of doctors and nurses sent from other provinces, and also we have enough masks and protective suits for us. So maybe it's a little bit different from Europe to China.
Because in Europe right now, they're severely lacking, right? Medical personnel and resources. Professor Luo, how would you then advise, healthcare personnel, doctors, and patients in Europe? What kind of tips can you give them based on your experience?
To the healthcare system staff, I think they protect themselves, and then they can help more and more patients. If they get infected, they maybe cannot help other people. Yeah, it's for the healthcare staff. And to the people, the common people, they should stay at home and don't go outside. And if they have to go to outside, put on the mask and always wash hands before you touch yourself. Yeah. It's my suggestion.
Do you think healthcare professionals in Europe, in the US, are they protecting themselves enough right now?
I don't think so. In Wuhan, we have 42 doctors and nurses work from other provinces. Right now, according to what reported from the government, nobody have been infected by the virus. So personal protective equipment is very important for the healthcare staff.
Medical systems worldwide, they're also different from China's. They're not like for like. So what are some of the common best practices besides, you mentioned protecting yourself, doctor and patients, what else can maybe the rest of the countries of the world learn from China?
I think the very, very important thing is that separate the patient from healthy people. It's very, very important. Yeah. So the test of the virus is very important. It can make a diagnosis, and then you can separate the patient from healthy people.
So isolation.
Isolation, yeah.
Professor Luo, you know, the situation in Wuhan, in Hubei, they appear to be stabilizing right now. But when you first went there, of course, it's a different case altogether, right? Because, so what were some of the challenges that you faced when you first arrived in Wuhan?
Yeah, there were so many patients over there. Also, the test for the virus is very, very slow, and also the pressure of oxygen is, in the hospital is not so good, but it improved soon. So it's the challenge for us at the first stage. Yeah.
How did things get better? What did, you know, China do right?
Yes, I think the government take very restrictive measures to prevent the spread of the disease from cities to Wuhan to other cities. The first is very important things. The second thing is that put the people that stay at home and protect themselves. And the third thing is that the government sent a lot of doctors and nurses to Wuhan to help them, and also send a lot of medicine, ventilator, masks, and protective shoes to Wuhan. Yeah, it's very helpful. And
so all these help from all fronts, they were all deployed to Wuhan, to Hubei, to really help out. And this actually played a huge role.
Yeah. For example, in our hospital, when we leave Chengdu to Wuhan, we carried a lot of protective shoes. Almost most of the protective shoes brought by us from the hospital. Yeah.
But what about other countries? If they don't have the capacity like China to deploy all these resources?
I also see that some countries send army to help the people. I think it maybe work. I think the army maybe help the people for fighting the virus, I think.
Of course, China's military has also helped you guys on the front line.
Yeah.
Professor Luo, you were also in charge of the ICU unit, right?
Yeah.
And you saw about 20 patients died in your hands. What are the common themes among these people who have died? I mean, what are the risk factors? Is it because they had pre-existing medical conditions? Were they old?
Yes, the age is one of the risk factors. If the patient older than 65, maybe it's very dangerous for the patient. Also, some other conditions such as very fat, overweight, and also have some chronic diseases such as COPD, hypertension, diabetes, maybe the patient may be progressed in critical condition and died from this disease. So doctors should pay attention to this kind of patient.
We are also seeing now younger and younger people getting infected. Some in their 30s even, they died because, I'm not sure if it's because of COVID-19 or because of other, coexisting reasons. Why is that the case?
I think most of the young patients can recover from this disease. Maybe in the early stage in Wuhan, some very young patients died from the disease. I think maybe it's just because the healthcare system is so busy in the early stage, so it's a problem. But after that, I think the situation improved a lot. Yeah.
Right. So for a younger person to actually die from this COVID-19 is still quite rare, right?
Very, very rare.
Very rare.
Right now.
Right. Professor, I think I asked you this question just now, but if you could maybe let our audience know, just maybe if you can give one example of a successful case that you actually worked on, a patient from the moment the patient was actually diagnosed with COVID-19 up until the patient has recovered and got discharged from hospital. Walk us through the process of how you treated the patient.
Okay, I will share one case. The one female, she is 46 years old, and she suffered from this disease and had difficulty in respiration is very significant. So the pulse oxygen saturation is almost just 46%. We give her the non-invasive ventilation and also large dosage of the steroid, and then the patient recovered and discharged from the hospital, and we're all very happy about it. Yeah.
So this patient had low oxygen level, but she was given non-invasive ventilation as well as a little bit of steroids.
Not a little bit, a lot
of steroids. Right. This patient, she's 46 years old. How long did it take from the moment she was diagnosed up until she recovered? What's the time?
It's almost 3 weeks. Yeah.
3
Diagnosis and then discharged from the hospital. It's very successful. Yeah.
Is she an exceptional, a special case? I mean, why did you decide to use these two treatments on her? Can this be applied to other similar patients with similar symptoms?
In fact, we have, I just summarized the 13 cases we used the large dosage of the steroid. And maybe I think there's 7 cases discharged from the hospital, and I can maybe 4 died from the disease. So all these patients were in very critical condition, and some of them recovered from the treatment. So I think it maybe is successful.
For patients who recovered, Professor Luo, I'm just curious, do they, what about the functions of their lungs? Because I read that their lungs will get scarred. So even if you recover, there's a downside to it. How often do you see this happening?
This disease may be different from the SARS in 17 years ago. After recover from this disease, the lung function improved slowly, and I think most of them will recover from this disease. It's different from SARS, and in SARS there's a lung fibrosis in the lung, but in this disease I don't think it's very important for the patient. Most of them recovered. Yeah.
So of about 300 patients that you have actually administered, not many have their lungs scarred? Would you say that?
In fact, we have a very, very severe cases. One young man, I think it's 38 years old man, and after recovered from the disease, I think it improved week by week. Yeah, so I think it's very, very strange for him, and very so different from other diseases, I think. Yeah.
Okay, different in a sense, but not, they don't see their lungs severely impacted after the disease, right? Okay.
I think the can recover totally. Maybe not totally, maybe 80 or to 90% maybe recover, I think, yeah. But it still need in study about it. We may monitor the pulmonary function for this kind of patients, yeah, in the maybe 1 year, 2 years, and.
But right now, you don't see it as too much of a problem, right? Scarring of the lungs. Okay. Professor Luo, I would like to ask you a little bit about, the virus itself. Why is it that some people who are exposed to an infected person, they end up getting infected, but some people don't get infected?
I don't think so. I think most of us are suspected to this disease, so you should protect yourself. Don't take the test to expose to the virus to test that if I can get the infection or not. It's very dangerous, I think. Yeah, don't take these risks. Protect yourself. Always put on masks and wash your hands. It's very important. Yeah.
So what I'm hearing from you is that you believe that this virus transmits very fast. So essentially, almost everyone can get it.
I think most of us, yeah, can get it. Yeah, can be infected by this virus. Yeah.
Do you think that's the case right now in China, that perhaps there are a lot of people who don't have symptoms, but they actually have the virus?
I don't know. We should study about it. Yeah.
Professor Luo, when someone has severe symptoms, say I'm coughing really badly, I've got a high fever, does it mean that this person's ability to infect someone is higher than someone who doesn't have symptoms but is also tested positive for the virus?
In fact, in the early stage of the onset of the disease, maybe it's very easy to spread the virus to other people. And but there is a study said that even the patient don't have symptoms, and the virus in the upper airway still have a higher concentration. Yeah, so be careful.
Yeah. Professor, after patients have recovered and they get discharged from hospitals, you've seen 284 people recovered. What are the chances of them being reinfected again?
Generally speaking, the virus infection diseases is not so easy to reinfect again, because we have most of us have the antibody against the virus after the infection. It's the principle of the vaccine. Why we use the vaccine to prevent the infection of a virus, just like flu. Yeah. Maybe there is a chance, but the chance is very, very low. Yeah.
I read some stats, I think based on quarantine centers in Hubei, about 5 to 10% of patients who have recovered, they end up getting reinfected. Is that what you're seeing? Is that what you saw in Hubei?
I don't think it's reinfect. Maybe it's just because of the false negative of the test for the nuclear lactic acid. Yeah. The test for the false.
Oh, it's so
negative test for the virus. Yeah.
Okay, so the test results is not entirely accurate. Is that what you're saying? Professor Luo, once a patient has recovered, can they infect other people around them?
I don't think so. Yeah. But in Wuhan, after discharged from the hospital, the patient should quarantine themselves for 14 days and then test the virus. And I think all those procedures can prevent the spread of the disease to other people. Yeah.
Professor Luo, I would like to bring this conversation back to your experience on the ground in Wuhan. You know, a city that has been locked down, under lockdown for so long, over 2 months. Talk to us about, you know, what goes through or what went through your mind when you were actually, you know, day in, day out, being exposed to all these patients. Did you feel fear, anxiety? What did you feel then?
Yes, in fact, I just worry about the patient. Because you feel so sorry for the patient. It's just happened suddenly, and maybe some patient lost their family member, and so you worry about them and feel so sad for them. So I don't worry about myself, and slowly the situation improved. So we are so happy. Yeah.
The situation improved when you started getting more help, right?
Yeah.
From all around in terms of people. When you and your colleagues were fighting, saving patients in the hospitals, right? What kept you going? How did you support one another?
Yeah, sometimes we felt frustrated because of died of the patient. So we talk to each other and support each other, take care of each other, and overcome this kind of frustration. And in fact, I have been a doctor for almost 30 years, and in this very short time, there's so many patients died from this disease. It's very, very frustrating for us. Yeah.
Because you've never seen something like this before.
Never. Yeah.
In terms of the right, people who just 20 people died in the 1 to 2 months that you were.
Yeah, that's true. In fact, in the very beginning, the percentage of the deaths maybe higher than the later stage. Yeah.
If I may ask you this, if you could maybe, I don't know, do something differently, you know, what would it be?
I don't know. In fact, we try our best to help the patient, but as you know, there's so many patients over there, and the condition of the hospital is still very, very difficult, and oxygen supply and some medicine and all these kind of things were the challenge for us, and but later by later it's improved, so we are happy. Yeah.
Professor, it's been 2 months since you spent 2 months in Wuhan. Do you think you know a little bit more about the virus now compared to before you went to Wuhan? Do you know more, have more knowledge about the virus now?
Sure. Yeah, I'm confident about the disease right now. I know that how to treat the patient and how to help the people, and also how to protect myself from the disease. So, but we still need more and more knowledge about the virus. For example, how the virus infect the people, and how the virus damage the lung tissue and other organs. So there's a lot of questions remain to be investigated.
What are you most concerned about right now about the virus, not just within China, but the rest of the world?
Yes, I worry about the virus all over the world because we are in the same Earth, planet. So I hope they can control the disease soon in other countries. Because as you know, there's so many cases from other countries in China. So I still worry about maybe sometimes if you not be so careful, maybe spread to other sites. Yeah.
Professor, just to maybe just wrap things up a little bit, right? So in terms of the advice that you would actually give to medical experts outside of China, it would be to protect yourself. Yeah. So can you summarize specifically how can a medical, a frontline doctor protect him or herself? Besides the suits, I mean, what else is needed?
Don't work so tired because if you work so long, and the immune system may be damaged, and you may be infected by the virus. But I think if you protect yourself by the personal protective equipment, I don't think it's so easy to be infected by the virus. So, and my suggestion is that protect yourself by the protect shield and masks and sometimes face shield, and it's very important, to protect yourself. As to the treatment of the patient, I think one doctor said that to cure sometimes, to relieve often, and to comfort always. As to the COVID-19, to cure sometimes means that there is still no specific effective medicine for this disease. We should select the antivirus drugs for the patient according to the situation or the condition of the patient. To relieve often means that we give support for the patient, such as fluid supplement, oxygen therapy. To comfort always, that means not only give the patient treatment of medicine, but also the psychology comfort for the patient. Yeah.
So targeted, the medicine given depends on the patient's conditions, relief. Yeah. Just curious, did you use this drug called chloroquine?
Yeah, we use it.
Use it?
Yes, but this medicine, I think, like I used for one patient, and because we in the hospital we did not have the medicine in the early time, and we tried one patient, and the patient recovered 2 days from the high from fever and difficulty in breath, and he felt better 2 days later, after the treatment of this medicine.
So some of these relief medicine, actually they do work in bringing down the symptoms, right? They do work right now in the absence of a vaccine. Great, thank you so much, Professor Luo. Really, thank you so much for everything that you've done for us. I understand that you have a daughter. Is it 20-year-old daughter?
Yeah.
Were they very worried, your wife and your daughter, when you were sent to Wuhan?
Yeah, they worry about me and call me every day and give me support. I really miss them, and
And what would be the first thing that you would do after you get out of quarantine?
I want to meet them
Yeah?
as soon as possible. Yeah.
What would you say to them when you meet them?
And when I meet them, I want to say that I love them. Yeah.
Right? I mean, love is, you have seen death, in the face of death. I mean, you actually have seen people dying. So definitely treasure your loved ones and treasure life.
Yeah.
Right. Thank you so much, Professor Luo. Really
Thank
a
you.
pleasure having you join us this evening.
Thank you. Take care. Yeah.
Thank you. Right, and that's it from us. I was just speaking to Professor Luo Fengming, who is the Deputy Director of the Pulmonary and Critical Care Medicine Department at West China Hospital. Thank you for joining us.
Thank you.